Hello friends, let us discuss about mycormycosis. Sources for this topic is the Hindu and Indian Express newspaper. So what is mycormycosis? It is also called as black fungus or zygomycosis. It is serious but rare fungal infection caused by a group of molds called as Mucormycetes. So what are the types? There are 5 types. First one is sinus and brain mycorrhizasis. It is an infection in the sinus that can spread to the brain. It is most common in people with uncontrollable diabetics and in people who have had a kidney transplant. Next is lung mycormycosis. It is most common type of mycorrhizasis in people with cancer and who have done a organ transplant or a stem cell transplant. Next is gastrointestinal mycormycosis. It is most common among young children than adults, especially premature and low birth weight infant less than 1 month of age who had an antibiotics, surgeries, or medications then lower the body ability to fight German sicknesses. Next is skin mycormycosis. It occurs after the fungi enter into the body through a break into the skin. For example, after surgery, burn, or other type of skin traumas. So next is disseminated mycormycosis. It occurs when the infection spread through the bloodstream to affect another part of the body. That is, the infection most commonly affect the brain, but also can affect other organs such as heart, skin, spleen, etc. Next, let us see about transmission. This mucormycosis does not spread between people or between people and animals. Here, the lungs or sinus form of the infection can occur after someone inhales the spores from the air. And next is, it is usually occurs in people who have health problems or take medicines that lowers the body, that is to suppress the immunity. One's body ability to fight German sicknesses. Next is symptoms: headache, nasal or sinus congestions, black lesion or nasal bridge or upper inside of the mouth, fever, abdominal pain, and gastrointestinal bleeding, etc. are the symptoms of mucormycosis. What are the diagnoses? So, in this, they will collect a sample of fluid from the respiratory system of or may perform a tissue biopsy. In tissue biopsy, a sample of affected tissue is analyzed in a laboratory for evidence of mucormycosis under a microscope or in a fungal culture. Treatment. So it needs to be treated with prescription antifungal medicine to prevent mycormycosis and other mold infections. Often, mucormycosis requires surgery to cut away the infected tissue. For people who have weakened immune system, there may be some ways to lower the chances of developing mycormycosis. So here see about Mycorrhizitis. It is the group of fungi that causes mycormycosis are present throughout the environment, particularly in soil and in association with decaying organic matters such as leaves, composite files, and animal dung. Several types of fungi can cause mucormycosis and belongs to the scientific order Mycorrhizitis. The most common type that causes mycorrhizasis are Rheopus species and Mucus species. They are most common in soil than in air, and in summer and fall than in winter or spring. These fungi are not harmful to most of the people, but for people who have weakened immune system, breathing in Mycorrhizitis spores can cause an infection. So let us see about UPSC prelims quiz based on the discussion. Consider the following statement about mucormycosis. It is serious but rare bacterial infection caused by a group of mold called as Mycorrhizaceae. Mycormycosis does spread between people or between people and animal. Often, mycormycosis requires surgery to cut away the tissue infection. Mycormycosis needs to be treated with prescription antibacterial medicine called amphotericin B. Diabetic mellitus is the most common underlying cause followed by the hematology and solid organ transplant. Mucormycosis has been observed in the patient or COVID-19 recently. Which of the following statement is given or incorrect? So we have to identify the incorrect statement. Let us see the statement one by one. The first statement is wrong. Why? It is a serious but rare fungal infection, not a bacterial infection. Therefore, option statement 1 is wrong. Therefore, you can eliminate option C and D. So remaining A and B. Let us see. Move on. Mycorrhizasis does not spread. Here it is given that mycorrhizasis does spread. This statement is also wrong. Often mycorrhizasis requires surgery. Yes, this statement is correct. You can eliminate option B since we have to identify the incorrect option. So the answer for this question is option A, 1, 2, 4. Let us see the remaining statements. Mycorrhizasis needs to be treated with prescription antibacterial medicine called as amphotericin B. It is a antifungus medicine. Therefore, this statement is wrong. Statement 5 and 6 is correct statement. So here we need to identify the incorrect statement. Therefore, option A, 1, 2, 4 only are the answer for this question. Next is question number 2. Consider the following statement about Mycorrhizitis. They are more common in air than in soil, and in summer and fall than in winter or spring. These fungi are harmful to most people, but for people who have weakened immune system, breathing in mycorrhizasis spores can cause an infection. Which of the following is or are correct? Statement 1, 1 only, 2, 2 only, 3, both 1 and 2, and option number 4, none of these. The answer for this question is none of this. Why none of this? Since they are common in soil than in air. So therefore statement 1 is wrong. Let us see about statement number 2. These fungi are not harmful to most people. Here it is given as these fungi are harmful to most people. Therefore this statement is also wrong. Therefore both the statements are wrong. Answer for the question is option number 4, none of this. Thank you. Have a good day.